Guys, welcome back to Medical Coding with Blue. Today's episode is all about CPT study tips for medical coders. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So, if you have your CPT Professional Edition by the AMA, this video is for you. So, with students and this particular book, okay, I'm not going to show the book because I have the 2025 right now. And, you know, sometimes people don't want to watch these videos if they're from older versions of the book. The fundamentals are still going to be the same. That's why I'm not showing the book, okay? But I want you guys to understand this. When it comes to studying this book, there's all of the outpatient procedures. There is the evaluation and management codes. There are the modifiers. So there's a lot of information, and it can be very overwhelming very quickly. But this that I'm going to share today is one of the ways that you should be studying this book, okay? Keep in mind that I never recommend tabbing, writing, or highlighting because that is just a waste of time because all of the answers are already in the book. You just have to know how to use the book. And that's what I'm going to share with you today is how to use the book and how to study with the book so that everything starts to make more sense. The more time that you put into studying, and it is 20 hours per week, you are studying for 30 minutes at a time or 1 hour at a time, but it is entirely possible. I have talked myself till I'm blue in the face with this 20 hours per week. So you can hear it on my other videos as well, how to achieve those 20 hours. It is possible, but 20 hours per week, 30 minutes at a time or 1 hour at a time is what you're going to do to study. When you're doing those long stretches of time, those cram sessions, it's just nothing's going to stick, and it's just going to make it more frustrating and overwhelming for you. Okay, so here's the first thing that you got to do is, you know how you always start with the beginning of the book? Any other time I would say, yes, of course, start with the beginning of the book. But actually this time, I want you to start with the back of the book at the index. At the beginning of the index, you'll see that it's going to say index, and it says instructions for the use of the CPT manual. So it's going to talk about all those things, and we'll go over that in here in a minute. But it's a total of 236 pages, the index, right? From beginning to end, right? And that is in the 2025 version. So if you have a newer one, it may be a little bit more, you know, whatever the case may be. But it's roughly, you know, that much, right? Let's just go with 240, okay? And with that said, what you're going to do, the very first thing you do, don't do anything else with this book until you have literally sat down and opened up the index and looked at every single entry that the index is offering. So what you're doing is you're setting a primer with this action, okay? A primer in your brain, because what it's doing is it is familiarizing yourself with what is available. Sometimes we don't know how to look up codes, and so because of that, that's when we get really lost and confused, and oh, this is boring, and I hate this, and no one's teaching me. A lot of times we're learning on our own. So that's why I want you to set the primer first, okay? We need to know what's available, so that way when we start looking at the questions, we could say, okay, yes, I know, right? There's a code here for that. I remember seeing that. Okay, so the first thing that I want to say is this. On that very first page, it's going to talk about main terms, like the procedure or the service. It's going to talk about the organ or the anatomical site. It's going to talk about the condition. It's going to talk about synonyms, eponyms, and abbreviations. So these are all ways that you can find procedures in the index. So keep that in mind. You can either find it by the procedure name, you can either find it by, you know, the name that it's known as, or you can find it by like the location, you know, or what are you doing? What type of procedure is this? So there's many different ways. This is why I'm telling you to go in and you look at it first, so that way we have that primer. We know what we're seeing first before we start getting into looking up the codes, because then this is going to become more familiar to us. Then you have modifying terms, right? So it's going to talk about a main term may be followed up by up to 3 identified terms that modify the terms that they follow. For example, the main term is endoscopy, is subdivided by the anatomical sites in which the procedure is used, and within these anatomical sites, the specific purpose of the procedure is identified. In the following example, the code for endoscopic removal of a foreign body from the bile duct would be located as bile duct removal foreign body, and then it gives you the code, right? So it says, note that in this entry, the inclusion of the sub-entry under removal implies that the reading removal of the term that follows it, if no subheads follow removal, the procedure would relate to the subhead that preceded it, as in this entry for the endoscopic removal of the spleen removal. Okay, so it doesn't have to add, removal of the spleen. It can just say removal and then spleen, because we already know, okay, if it's saying this, then it's this area or this organ or whatever the case may be. So then it goes on and explains a little bit more. Then it talks about the code ranges. So sometimes when you're looking at the entries, it will give you a code, a single code, or it will give you a range of codes. So it'll give you the 5-digit code, and then it'll give a little dash, and then it'll give another 5-digit code. So when it's doing that, it's saying that there's a range. This is the range that this procedure would fall in. So then you would go into the tabular section, which is in the front, towards the front of the book, and you're going to look up that range, and you're going to try to identify what specifically procedure are you looking at there that's going to match up with whatever procedure that you're trying to code for. So it's very important to keep this in mind. They always tell us to never ever code from the index, and that is true even in CPT. Okay, you need to look up in the index and then go to the tabular and go look at the exact code in the chapter. And then sometimes it is a really good thing if you get into a habit of looking up and also looking down, just to make sure that you're in the right code, or if there's a more specified code, then that's how you're going to be able to get the correct code. Okay, so it's not just about, oh, it says here in the index. No, you need to make sure that you're going to the tabular and you're verifying. Okay, and that's how we get to doing that, because that's how we start to learn, oh, there's these other things out here. Or maybe what we're thinking that we're looking up, we think is correct, when in actuality, when we go to the tabular section, we see that that's actually not correct, that there's something else there that is saying that is some type of other thing that's going on in this procedure that maybe didn't happen in that procedure. Those are things to watch out for. Then it talks about the coding conventions, right? As a space-saving convention, certain terms carry meaning inferred from the context. This convention is primarily used when a procedure or service is listed as a subterm. For example, knee, and then exploration of, and then that gives a code. In this example, the bracketed qualifier of does not appear in the index. Of is an understood in the context of the term exploration. And then it gives another example. So some of these little words like of, they're going to be eliminated from the index. So it's just going to give you the main term, not the main terms, because that's something different in here, but it's just going to give you direct terms. There we go. It's just going to give you direct terms. So it's going to say removal and then spleen. We don't have to say removal of spleen. Okay, so that's what it's trying to say here. So take a look at this, so that way it can kind of help you to understand. But again, the main first thing that I want you guys to do is look at the index, and you're going to look at every single entry and every single indention, because they're going to be indentions where you're going to see like this is a procedure, and then it's going to be of this location, and then it's, oh yeah, because of this purpose, or whatever the case may be. So that's why you have to look and see what you all have available. There's Abby Eastlander, right? Hope I said that right. Procedure, that's going to be your first one, right? And then it's going to say abdomen is going to be your next one. And then it's going to say, see also abdominal. And then it's going to go through all of the procedures that are available there. So if you have an abdomen procedure, you can go here and try to see if you can find it. Whatever procedure they were having. And then so it's going to go on to abdominal. And then it says, see also abdomen. So it can kind of bounce you back and forth, but depending on what the procedure is and what's going on in that procedure. So it's going to give you all of the terms that it has there. And then it's going to continue on and then there's more, and then it says ablation, and then it's going to give you all of the places where you can have an ablation. Then it's going to have more terms, and then it's going to say abscess and all the places that you could have this abscess. So again, something to kind of be mindful of when you're thinking of like abscess and it's in a particular area. Think of it as, is it on the skin, or is it on the bone, or is there some other structure that has the abscess? That's the thing that you want to think about. But again, if you see this here, again, this is putting that primer into your brain that, hey, there's a code for that. And then you can start looking at these different code ranges. Okay, so we know the 20,000 series, that's going to be our musculoskeletal section. We know in the 10,000 series, that's going to be our integumentary system. So those are things that you're going to be able to start relating to, right? As you're working through and looking at this index. This is an absolute must. Yes, it is 236 pages, but it is an investment of looking and getting familiar and saying, oh, okay, yes. Oh, there's a procedure for that. Oh, okay. Well, there's also, what is that procedure? And so you can Google it. You can get a medical dictionary and try to look it up. But that's also going to give you that exposure to different procedure names. And what does this mean? What does that mean? If they're doing this, what kind of procedure is this? So that's how you're going to start building your knowledge. This is something that is an investment on your part, and it costs you $0 to do. Literally, it costs you $0. So all you have to do is just keep looking. And all you're doing is looking at this main term, and you're looking at all the things that, could happen in this particular procedure. For example, they have here Achilles tendon. So they have an incision. They give you some codes to look at. They have lengthening, and they have repair. So there's all of those types of procedures for the Achilles tendon. Okay. And so you're going to keep on going, and you're just going to look at all of these titles of these different procedures and things like that. They have one for adhesions, the adrenal gland. And so you're just looking at all of these things. And as you keep looking in this, all of this is setting into your brain. I will keep saying it over and over again because repetition is the key to adult education. But you're going to look at these, and you're going to keep going. And as you keep going, then it's going to start to stick. You're not going to get this on the first round. You're going to get this more and more and more as you practice. Okay. Then I'm turning the page, and I see anesthesia. I see all of the procedures and all of the locations and things like that, all the different kinds of procedure names that could be for anesthesia as well. Angiography, angioplasty, you need to know what those prefixes and your suffixes are, okay? And root words are very important, and I will talk about where you can find some here in the CPT manual. But we keep going, and we're looking at all of these. It may take you a few days to flip through all of these pages and just to look at all the options that they have available. And if you want to just look at the blue terms, because they're all in blue, and then of course you have the procedures in regular type, that's really what you're looking at. It's going to grab your attention, and it's going to keep you here. Okay, oh, there's all these procedures, the aorta, right? And you're going to keep going, but you're going to keep looking through all of these, so that way you can get familiar with what's here. You can isolate some of these procedure names that you don't really know what that means. What does that mean? So you can start Googling whatever you don't know, okay? And you're going to feel like it's a lot, but you don't have to look up every single one right away. This is just setting the primer, okay? You're not having to know all of these. You're just setting the primer. So you keep going, and you're going to be like, wow, I didn't know there was a procedure code for that. So again, with all of that, it's going to help you to feel more confident as you're going through and looking things up in the tabular section. Now, in the interest of time, you keep doing this all the way. If you want to take a certain group of pages and you flip through it on that day, and then do another group of pages and then flip through on another day, that's totally fine. The point is to get it done. Okay, that's the point. So when we flip all the way to the front of the book, and that inside flap we see a list of all the symbols. The symbols are very important because the symbols is going to tell you a lot more about what's going on. Like, for example, if you see a plus sign, you know that's an add-on code. We know when we see an add-on code that there has to be a code that goes with it first. That code that has a little plus sign on it cannot be reported by itself. Okay, that's very important for you to know, because sometimes when you're looking up stuff and you'll see that code and you're thinking, oh yeah, that's it. No, if you see it's a little plus, it's part of another procedure, right? So you got to look up and see what procedure it's involved with. Okay, so it's going to give you all the symbols right here and what they mean. The modifiers. It lists them here, and then it says, see Appendix A for definitions. So sometimes there's going to be some things that you're going to get confused on. I know a lot of people get confused with modifier 24 and 25. These are two completely different trains of thought, but they get confused on those, and that's something that you're going to have to make sure that you know forward and backward. When do those apply? Because that is money. That is money for that provider. So you need to make sure that you are coding it appropriately. Appending it to the appropriate evaluation and management level. And you need to make sure that you are doing that, because if you don't, those providers are going to lose out. That patient may have to pay more money. And we all know that healthcare is very expensive. And we need to be doing our part as ethical coders to make sure that we know when and how to apply these modifiers. Okay, so there's all of these modifiers listed here. Then you have your place of service codes for professional claims. Okay, that's just more reference for you. But if you look, as you get into like past the table of contents and stuff, if you're looking past the introduction, the introduction is going to tell you a lot more in detail about like the add-on codes and the symbols and things like that. So do not skip that. It says right here, illustrated anatomical and procedural review. So prefixes, suffixes, and root words. It literally will give you a whole list of numbers, prefixes, surgical procedures, the suffix, the meaning of the suffix, and an example of that procedure. So again, something that is here in the book that you will have with you, and just knowing that it's here in case you forget, that is going to help. Okay, that's why writing is not necessary, and doing all these notes is not necessary, because all of this stuff is right here. And then we have conditions. We have prefixes, the meaning, and the example. And then we have suffixes, the meaning, and the example. We have directions and positions, the prefix, the meaning, and the example. And then again, more words and more meanings. So then it talks about like the medical dictionaries that they use to kind of help them with this. Those are great. Dorland's is one of them. Fantastic medical dictionary, okay? If you want to buy your own. Then it talks about anatomy references. Again, more really good references on anatomy here. Then it has the anatomical illustrations. So it's going to give you the page number and then the illustration table for any of these ones that are listed here. So sometimes if you're thinking, oh, this is talking about the skull, and I forgot, so then you're going to be able to find an actual anatomical illustration in this book. So it's a whole list here, more procedural illustrations that it's talking about, and then it gives you some color pictures and things like that you can see for yourself, the different planes and stuff. And then it's talking about evaluation and management. Now this is where a lot of people start hyperventilating, which is unnecessary, because evaluation and management is literally not that difficult. All you have to do is just look at the chapter. The main thing about learning about evaluation and management is understanding some of the nuance, right? But also understanding that table of risk, okay? Now, I do have the self-study specifically for evaluation and management, but you do have to purchase the book from Optum, because that is the book that goes with that particular study syllabus that is specifically for evaluation and management. And you can find out more about that in the description box below. But here in the book itself, it's telling you about evaluation and management. So this is something that you're going to have to read directly. Another sit down and read it. And guys, it is not that long. It is not that long. It is literally just a few pages. Literally 1, 2, 3, 4, 5, 6 pages front and back. So 12 altogether. Okay. Yes, it's double columned, but guys, it's a lot. But again, if you're doing this simple action, this is what is going to help you to understand evaluation and management much better than you ever expected. Because a lot of times people will listen to other people and they'll say, oh, well, I don't understand evaluation and management and I'm so scared of it. And then that fear begets more fear. And we don't need that, okay? So stop listening to all of that and just start picking up the book and looking at it. And you're looking at this evaluation and management here. It's describing, what these things mean. What does split and shared visits mean? Multiple evaluation and management services on the same day. It talks about that, right? Services reported separately, history and or examination, guidelines for selecting the service based on medical decision making. It talks about all of that. It gives you a table for levels of medical decision making. And then it's talking about all those things. So you'll see those examples there. And those examples are not all inclusive. You'll see the low risk. It doesn't have anything there. But there's a wealth of information out there about what constitutes a low medical decision making risk. In that in the last side of that table where it says risks of complications and or morbidity, you'll see lots of examples out there. For what low risk means, okay? So don't panic that you don't see anything there. Then it's going to talk about the meanings of minimal problems, self-limited or minor problems, stable or chronic illnesses. It is going to literally explain everything here. And yes, it's not going to make sense the very first time you read it, but that's not the only time you're going to read it, right? You're going to continue to read it. The thing is, you're setting the primer. How do we set the primer? By going through it once, taking a break, coming back to it again, going through it a second time, okay? Until it starts to make more sense. But until you start to actually do it, do not run around and say, oh, it's hard, when you haven't put in the time yet, okay? The other thing that I want to do, because I'm already running out of time, but this is very important because yes, while you need to look at the procedures and make sure that you're reading some of those chapter notes and things like that, I'm going to stress this, evaluation and management. You should be able to answer rapid fire what these code ranges are for a new patient, right? What an established patient, those codes in the office outpatient visit. You should be able to rapid fire answer the code ranges for new patients and established patients. You should be able to describe and explain what a new patient is and what an established patient is, okay? You need to know those things because they're going to ask you when you get out in the real world what that is. And every coder has to know what it is. You have no excuse to sit there with the deer in the headlights like, oh my gosh, what is it? That's why reading the E&M chapter, which again is not that long. It is not that long at all. It starts in the 2025 anyway. It starts on page 15 and goes all the way to page 65 rather. So you can take a weekend, you can take an evening and just look at the evaluation and management codes. And it's going to tell you here, and it's going to give you advice that you need to read, okay? So office or other outpatient services, and then it's going to give you a coding tip, right? So it's going to explain a little bit, and then it's going to give you a coding tip. And then you're going to see new patient, and it's in red, 99202, and then you see 99203, 99204, 99205. That's new patient. That's the code range from 99202 to 99205. And then you see established patient, and then you see 99211 to 99215. But you got to be careful because you have to read what each one of these are saying, right? So like, for example, the 99211, this is where really it's our nurses that are getting this, right? Because it says here, For office or other outpatient visit for the evaluation and management of an established patient, they may not require the presence of a physician or other qualified healthcare professional. And then we have 99212 that talks about office or other outpatient visit for the evaluation and management of an established patient, which requires a medically appropriate history and or examination with straightforward medical decision making. When using total time on the date of the encounter for the code selection, 10 minutes must be met or exceeded. Did you see any time for 99211? No, you did not, because that is not something that applies to that code, but it starts applying at 99212. So those are things that you're going to see, but the only way you're going to see and know those things is if you're actually spending the time to review these sections, okay? So you're going to take the time to review each and every single one of these. Again, not needing to memorize, you're just setting the primer in your brain, okay? And then in the meantime, in between time, it's talking about telemedicine services. It's giving you all kinds of different tables here for telemedicine and non-face-to-face services. Not anything that you have to memorize, guys. It's just putting it in your brain that it's actually there and it exists, okay? It's talking about different settings. Hospital outpatient services, when does that apply? Hospital inpatient and observation care services. And then it says, it gives you some direction. And then it says initial hospital inpatient or observation care, new or established. It goes through that, right? Then it starts with that 99221. So for my professional fee coders, my pro fee coders, when the patient is admitted to the hospital or staying up in the hospital and an outpatient provider comes up and does their rounds on them because maybe they're admitted by the internal medicine team. Internal medicine is looking over the patient and they see that they have a foot ulcer. The patient's also a diabetic. So they call up podiatry, say, hey, podiatry, we got a diabetic patient here with what appears to be a foot ulcer. Can you come check the patient out? Podiatrist says, sure, and they go up there. Well, that's the codes that we're going to start looking at, that so that provider can get paid for their service that they're providing to that patient. So there's that range there, okay? And then it goes on for the subsequent days, okay? Because it's not just the initial day, there's subsequent days, and then there's the discharge day. But you're going to know that by going through that section, okay? So guys, a lot of this is literally just sitting here going through this book, okay? So that way you can lay the foundation. You're not going to be so lost. And when you do this, and then you actually do get into the CPT part of your studies, guess what's going to be familiar to you? Because you've already been exposed. You've already exposed your brain to these codes. And even though you don't memorize them just yet, it'll be there. It'll be there. The more you practice with it, the more you look at this book, the more competent that you will be. Competence is something that is very, very critical, guys. It is not to be messed with. You have to be competent. And the only way you're going to be able to do that is by looking to see what is there. Okay, they have emergency department services. They have a coding tip for that. They have critical care services and what all that includes, nursing facility services. They have a home or residence service and prolonged services. So preventative medicine services, they've got all of these things here, guys, okay? Behavioral health, remote physiologic monitoring, they've got all of that, okay? So it's just something for you, again, to sit down and review so that you can face this head on, so that you don't have to sit here and wonder, oh my gosh, what did I get into? I hate this. No, you just need to learn it, and you just need to take the time to sit down and learn it. That's all, okay? But for the most part, those are my study tips for CPT. Now, you're going to get into anesthesia, and then you're going to get into all the sections, okay? And you're going to follow the same ideas. You're going to go through each and every single one of these chapters, a chapter at a time. Whenever you have time, just look through the chapter, okay? You're not memorizing, but what you're doing is you're familiarizing yourself with the location. You're familiarizing yourself with the code ranges because it's already there. This is setting that primer to accelerate your learning rather than trying to go in cold and having to learn CPT and you're like, oh my gosh, I have to look in the index and then I go into this tabular section here and I've never looked at it before. But you're going to be way ahead of yourself, right? Because you've already looked through those chapters and you're going to take it a chapter at a time. But you're going to start with that index. Then you're going to work your way to the front. You're going to go to the evaluation and management. You're going to read those. You're going to review the evaluation and management codes. Then you're going to review the anesthesia guidelines. Then you're going to start reviewing all of the chapter specific surgery guidelines is next. And then it starts with the integumentary system and it goes all the way through till the end of the book. Okay. So that's how you're going to study the CPT professional edition from the AMA, to lay those building blocks and get that firm understanding, so that way this is not going to be something new to you. The newer something is, the scarier it can be. The more we take the time to familiarize ourselves with it, the better off we are. And again, you can leave your book clean. You do not have to put tabs. You see mine is not tabbed up, and I use this on the regular, daily. And yes, I do have an encoder at work, but the things that I do, okay, me personally, I still use this book. And again, it doesn't have to be tabbed. The tabs are unnecessary training wheels that you do not need, okay? You do not need them. I want y'all to be strong coders. I don't want y'all to be so dependent on things that are not going to help you. It's not going to help those patients. It is not going to help those providers. Your knowledge of this book is what's going to help them. At least this is my advice anyway. So with that said, happy studying. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.